As the stigma around plastic surgery diminishes, there's a noticeable uptick in the number of individuals choosing to undergo cosmetic procedures. But is it really a good thing? In the past couple of decades, there's been a staggering rise in the number of individuals choosing to go under the knife in pursuit of the perceived perfection that's so frequently flaunted on our screens. A survey conducted by the American Academy of Facial Plastic and Reconstructive Surgery, AAFPRS, indicated that in 2018, 72% of facial plastic surgeons saw an increase in patients under 30 years old, many of whom were influenced by social media images. Non-surgical procedures such as Botox, fillers, and laser treatments also saw a significant rise. These procedures are often popularized through social media platforms, with influencers and celebrities frequently discussing their experiences. This surge isn't just a mere coincidence, it's a reflection of the profound influence that social media has on our self-perception and self-worth. But here's the thing. Social media often presents a highly filtered and airbrushed version of reality. It shows us the before and after shots, the transformative journeys, the miraculous results. Yet, it conveniently skips over the less glamorous aspects of plastic surgery, the potential risks, the recovery process, and the fact that results can greatly vary. This misleading representation can lead to unrealistic expectations and ultimately disappointment. What's more concerning is the impact this trend is having on younger audiences. In a world where likes and followers often equate to validation, the pressure to conform to these idealized standards of beauty can be immense. It's fostering a culture where cosmetic procedures are seen as a quick fix, a fast-track ticket to social acceptance. This skewed perception of normalcy regarding body image can be detrimental, especially when it encourages young individuals to contemplate plastic surgery at an age where their bodies and minds are still developing. The democratization of plastic surgery also has significant economic implications. More people are spending substantial amounts of money on procedures, often influenced by the latest social media trends. But these trends are fleeting, and the promised outcomes may not always materialize, leaving individuals to grapple with the financial aftermath of their decisions. With the uptick in demand, there's also the concern about the quality and safety of the procedures being offered. As less qualified practitioners try to capitalize on this trend, the risk of botched surgeries and health complications increases. Where once plastic surgery was a last resort, it's now becoming a norm, especially among the younger generation. As we become more desensitized to the seriousness of undergoing surgery, it's essential to remember that it is still a significant decision with lifelong implications. This democratization of plastic surgery, driven by social media, has far-reaching implications, both positive and negative. One of the most evident implications is economic. With the incessant exposure to idealized images, more and more individuals are investing significant amounts of money into these procedures. Whether it's a nose job, lip fillers, or more extensive procedures, the costs can rack up quickly, often without the promised or expected outcomes. But the implications aren't just financial, they're deeply personal and psychological too. A constant barrage of flawless bodies and faces can lead to a distorted perception of self and unrealistic expectations. It's breeding grounds for mental health issues like body dysmorphia, anxiety, and lowered self-esteem. The pressure to look perfect and the subsequent disappointment when the unattainable is unsurprisingly not attained can take a severe toll on an individual's mental health. And then there are the ethical and medical concerns. With the demand for plastic surgery skyrocketing, there's a risk of less qualified or even unqualified practitioners stepping in to meet the demand. This can lead to botched procedures, serious health complications, and even life-threatening situations. It's a concerning side effect of this trend, one that can't be overlooked or understated. Moreover, the constant exposure to plastic surgery on social media platforms is leading to a normalization and desensitization of these procedures. They're being viewed less as serious medical procedures with potential risks and complications, and more as casual beauty treatments akin to getting a haircut or a manicure. This shift in perception is concerning, as it downplays the seriousness of what is, at the end of the day, a surgical procedure. As these procedures become more common, we risk becoming desensitized to the seriousness of undergoing surgery, treating it as casually as any other beauty treatment. This trend might also contribute to a cultural shift where natural bodies and aging are seen less favorably, potentially affecting wider societal attitudes towards aging and natural beauty. In summary, while the democratization of plastic surgery has made these procedures more accessible, it's also created a host of issues. From the mounting pressure to achieve an unrealistic standard of perfection, stemming from a constant barrage of idealized images on social media to the misleading representation of plastic surgery, the consequences are far-reaching. The impact on mental health, particularly among younger audiences, is concerning. We've seen an increase in issues like body dysmorphia, anxiety, and lowered self-esteem. Not to mention the significant financial implications and potential ethical and medical concerns that arise from an increase in less qualified practitioners. As these procedures become increasingly normalized, there's a risk of becoming desensitized to the seriousness of undergoing surgery. It's important to remember that while social media can influence us, it's just a small snapshot of reality. True beauty lies in our uniqueness and self-acceptance, not in achieving an idealized version of perfection.